Hey guys, I'm going to talk about the cardiovascular physiology pre-lab learning of pulse and blood pressure. So I will go over the generation of pulse, how pulse is generated in our body. Uh, when your heart contracts, blood flows from the heart into the artery and pulsation in the arterial wall is pulse. So we're going to talk about how pulse is generated. Then in the wall of artery, when blood flows, it creates a pressure in the wall of blood vessel, and that is called blood pressure. So I will explain about how blood pressure is generated. When you see somebody's blood pressures are denoted by two numbers. One is written above or before another, and the first number is always systolic blood pressure and second is diastolic blood pressure. So we're going to talk about what is systolic and diastolic pressure. Uh, Blood pressure measurement corresponds with the turbulent flow of blood sound, and that is called Korokov sound. So we're going to talk about significance of Korokov sounds in blood pressure test. Uh, I will also explain about relationship between heart rate, stroke volume, and cardiac output. The respiration, which is inhalation and exhalation, also increase or decrease the blood pressure and heart rate. So we're going to see what is the effect of respiratory pump on blood pressure and heart rate. Then I will talk about heart rate and breathing, how breathing affects your heart rate. Then we'll go over how intrathoracic pressure changes blood pressure. And at the end, we will talk about heart rate and exercise, how heart rate uh, is affected by our exercise or how different organs demand increase during the exercise. Okay, so let's start with the generation of pulse. So you can see this diagram when our heart contracts, that is during the systole, blood enters from the heart into the great arteries, and great arteries are aorta, and the blood flow to the lungs is the pulmonary artery. So these are the aortic and pulmonary artery. During the contraction, you see there is more force, blood flow with higher force, and that is exerting force on the wall of arteries, and this is called the physical feeling of the pulsation is pulse. And when arteriole, when this blood get into the smaller blood vessel, which is called arteriole, blood pressure flows slowly because they branch. And after the the expansion of the arteries, when heart relax, blood vessel also recoil and relax. Okay, so this is the valve showing how we feel the pulse. So the sudden ejection of blood into arteries produced by each ventricle systole, which is contraction, forces the wall of elastic arteries to expand, and that expansion is felt as pulse. Okay. These pulse then can be taken into or felt into the superficial artery in the body. There are several arteries in the body where you can feel the pulse. For example, radial artery, carotid artery, temporal artery in the head, femoral artery in your uh, inguinal region, tibial artery. There are several other superficial artery where you can take the pulse. So to take the pulse, you took two or more than two fingers and press against the bone on the artery, and you can feel the pulse. So now blood pressure. So blood pressure is the force exerted by blood after our heart contracts. Okay. So blood pressure is the force of your blood pushing against the wall of your arteries as your heart pump blood through the body. So let's see here. When your heart contracts, blood is flowing through the artery, and during the systole or contraction time, the blood pressure will be like this way. And then when it relaxes, your heart relaxes, blood pressure drops. So blood pressure during the contraction phase of heart is called systolic blood pressure, and this pressure is high blood pressure. And during the relaxation phase, it is low blood pressure, and that is called diastolic blood pressure. So if somebody's blood pressure is 120 over 80 millimeter of mercury, that means 120 millimeter of mercury is her systolic blood pressure, and 80 millimeter of mercury is diastolic blood pressure. Okay. You will not feel the same blood pressure in every arteries and veins in the body. We take blood pressure in the artery in the arm or in the thigh, in the bigger artery. Okay. So as you know, blood vessels branches off. When the arteries becomes smaller and smaller and smaller, then blood pressure drops. When the blood reaches the veins, blood pressure is like zero, sometimes not at all, or very low blood pressure. Okay. So how blood pressure is generated? Again, blood flow in the cardiovascular system travels from region of higher pressure such as the elastic arteries to the lower pressure like the veins, as I said earlier. So you see here, this is the different size of arteries. So this is, let's see, here is aorta, then is smaller arteries, then capillaries, then veins. You see the blood pressure here? So this is diastolic blood pressure here and systolic blood pressure. So if this is zero and there is like uh, this is 80 millimeter of mercury and this is 120, so systolic, diastolic, systolic, diastolic, that means contraction, relaxation, contraction, relaxation. As the artery goes down, systolic and diastolic both are going down. So systolic versus diastolic blood pressure. Systolic blood pressure is blood pressure during the contraction of the heart, and diastolic blood pressure is the blood pressure during the relaxation of the ventricles, particularly the left ventricles. When left ventricle contract, that's the time blood pumped from left ventricle into the aorta and the large arteries, and that is systolic blood pressure. When left ventricle relax, blood pressure drops in these arteries, and that is diastolic blood pressure. So blood pressure is measured by two instruments, and those instruments are called stethoscope here, stethoscope, and this is called sphygmomanometer. So let me show you another diagram of a stethoscope and a sphygmomanometer. So here, this is this inflatable cuff and the tube hose with a squeezable bulb and the column of mercury indicating pressure in millimeter. These all together are called sphygmomanometer. You see, a sphygmomanometer. This is a stethoscope. The stethoscope has earpiece, and here is a diaphragm and the bell, and this is the hose which is connecting here. So you have here microphone inside this structure. So let's see, the patient is lying down and you have put the inflatable rubber cuff around 2.5 centimeter above the elbow, and then this column of mercury can be the long tube or circular tube sometime. So once you put the stethoscope here and then you lock the air valve and start squeezing this valve, which increase pressure inside this inflatable rubber cuff, and that will ultimately block this artery. This is called brachial artery. So that brachial artery is blocked now, and you will increase this pressure about 20 to 30 millimeter more than the expected normal pressure. So expected normal pressure is 120 by 80 millimeter of mercury in normal individual. But if somebody is, let's say a patient has like expected pressure around 160, in that case we're going to go and inflate up to maybe 190, and then you put it to a stethoscope and you start hearing stethoscope with a stethoscope. So you will not hear any sound because artery is blocked, so there is no flow of blood. Now you slowly release this air valve, and you release at a rate of around 2 millimeter of mercury per second, and very carefully listen the sound. So your eyes will be here and your ear will be hearing the sound. So once this mercury from here, from let's say 180, coming down, coming down, coming down, you are loosening the air valve and you don't hear. Okay. So if you don't hear this sound, that means no sounds, artery are completely closed. Now once you reach around 120 normal individual, you hear the first sound of blood flow because the pressure in the artery is more than or equal to the pressure in the cuff which you have created. And due to the turbulent flow of blood now through this artery under this inflatable rubber cuff is first time heard, and that first sound is called Korokov sound. The Russian scientist Mr. Korokov measured this blood pressure first and found this device. That's why we call the first sound of the blood pressure as Korokov sound. So this, when you hear the first, that sound is called systolic blood pressure, and that is due to arteries opening. And then after certain time, once happened, because blood is now flowing, but it is like squeezing through, blood is flowing. So there is turbulent flow, but once it is completely, artery is completely open, then there will be smooth flow and you will stop hearing the blood flow. And that is called, when you start smooth flow, you will not hear any sound. No sound will you will hear, because the artery is open. And once you stop hearing that sound, that is diastolic blood pressure, like at 80. Okay. So this is part of the sphygmomanometer and how you take the blood pressure. Okay. This is all coroscope sound and blood pressure test. I explained this set, everything. So you can see here, same thing. Okay, now relationship between heart, stroke volume, and cardiac output. These are the terminology. I will go over these terms again during our lecture. So, our heart pumps blood all over the body. The amount of blood pumped by our heart in 1 minute is around 5 liters. And that blood flow through the heart in 1 minute is called cardiac output. So how cardiac means heart. How much your heart pumps in 1 minute is cardiac output. And that cardiac output is the product of your heart rate, means how many times your heart beat per minute, plus times stroke volume. Stroke volume means the amount of blood pumped each time your left ventricle contracts. Okay. So cardiac output is the volume of blood being pumped from the left ventricle of the heart in 1 minute, and they are usually measured in liter per minute, and that is around 5 liter per minute. The rate and stroke volume determine the cardiac output. That means if you increase the stroke volume or heart rate, that will increase the cardiac output. If you decrease the heart rate or stroke volume, that will decrease the cardiac output. Any factors which increase stroke volume or heart rate will also increase the cardiac output, and any factor which decrease the heart rate or stroke volume will also decrease the cardiac output. Okay, so there are several factors that can affect cardiac output by affecting the heart rate and stroke volume. For example, venous return increases stroke volume and cardiac output. And so here, if your heart get more blood from the veins back, like from the superior inferior vena cava, then your heart will pump more blood. So let's see here. What are the factors that affecting this cardiac output, which is blood pumped per minute? So here, let's talk about first heart rate, and then we'll talk about stroke volume. So chronotropic agents. Chronotropic agents are the medicines or drugs which increase your heart rate, okay, or decrease your heart rate. So these chronotropic agents alter the SA node, sinoatrial node, which is found in the heart, and AV node activity, and they increase or decrease heart rate. So if they are positive chronotropic agents that increase heart rate, and negative chronotropic agents decrease heart rate, like beta blockers are negative agents. Beta agonists are positive agents. So if these agents, positive agents, will increase heart rate, which is beats per minute, and that's why it will increase cardiac output. Negative one will decrease it. Venous return. Blood volume of a volume of blood returning to heart alters stretch of heart wall or preload. So somehow if your leg veins, body veins is returning more blood to your heart, that will increase the size of the heart, stretch, volume of the heart. So more blood returning to the heart, more stretch in the heart, and more stretch will increase the preload, and that will increase the force of contraction of the heart, and that is why it will increase stroke volume or blood pump per beat. Similarly, ionotropic agents are the agents which increase calcium in the cardiac muscle cells, and they are also positive and negative. If they are increasing the calcium, they are a positive agent that increase heart rate, stroke volume, and if you are negative, they decrease stroke volume because they decrease the force of contraction. After load, if let's see, if somebody has arteries in the body, large arteries are like thickened, and in old age, arteriosclerosis, they are not elastic, no more elastic like young age. So old people, or genetically, if the hardened arterial wall, in that case, there is increased resistance in the arteries. And if there is increased resistance in the arteries, that means your heart has to work against the high pressure, and that is called afterload. Afterload is inversely correlated with the stroke volume. That means more the afterload, less the stroke volume, and less the cardiac output. Okay, so these are the factors which affect your cardiac output. So main two factors are heart rate and stroke volume, and heart rate and stroke volumes are also affected by other factors. Some affect directly, some affect inversely. Okay, respiratory pump. Our breathing also affect our stroke volume and heart rate. Okay. So one of the main factors that affect stroke volume is the amount of blood returning to heart. So how much blood return to heart during inhalation or breathing in, or exhalation, breathing out. Okay. So as the amount of blood returning from the veins increases, the pressure inside the ventricle increases. And so larger amount of blood will be pumped in each beat. Okay. So let's see during inhalation. When it's inhalation, during the inhalation, your thoracic cavity volume increase. So that's why there is decrease thoracic pressure, and your abdominal pressure increases. That's why more venous blood from the abdominal region return to your inferior vena cava, and from the superior vena cava also comes into your right atrium and then to the right ventricle, that drains blood to the lungs. Okay, and then when you exhale, what happens during the exhalation? Your thoracic cavity is contracting, so there is increased thoracic pressure but decreased abdominal pressure. So increased thoracic pressure now, because there is a lot of blood already from inhalation into the lungs, so lungs now sends more blood to the left ventricle. That means first in the left atrium and then to the left ventricle, and so left ventricle has more expansion and more force of contraction, and it expels more amount of blood. That's why during exhalation stroke volume is increased, which is earlier helped by inhalation because it brought more blood to the right heart and to the lungs. Okay. Heart rate and breathing. So during inhalation, the change in the thoracic and abdominal pressure decreases, as we know. and decreases the stroke volume. In order to keep the cardiac output approximately constant, the heart rate increases to compensate. So during inhalation, your heart rate usually increases because that time your left ventricle has less volume, so it is pumping less. And if you're pumping less, that means you have to increase your rate. That's why your heart rate is increases. But during the exhalation, it is just opposite. That means opposite occurs when you exhale. The increased intrathoracic pressure increases stroke volume, and that's why the rate decreases. Okay. How intrathoracic pressure change blood pressure? So when a stroke volume increases blood pressure, blood flows faster to accommodate large arteries, amount of blood that is pumped. Thus, a higher stroke volume leads to an increased systolic blood pressure. So during uh, exhalation, when you have more stroke volume, that means you will have more blood pressure. And during inhalation, you have low blood pressure. Okay. So what is the effect of exercise on our heart rate? Okay. So here, blood flow and heart rate during exercise. You have two diagrams here. You can see the total blood flow, which is cardiac output, is around 5 liter. That means 5,200, slightly more than 5 liter. 5,250 ml is 5 liter, around 5 liter. 5.25 liter basically. So it is 5,250 milliliter per minute. And when you're resting, you can see your brain gets 650 ml per minute, your heart gets like 250, skin 400, kidney 1100, abdominal organs 1300, and other organs 450, and most importantly, skeletal muscle 1100 ml per minute. But when you exercise, look here, some organs increase its blood flow and some don't. So you can see brain increase from 650 to 750, heart from 250 to 450 because heart has to pump more, skin 400 to 900 because skin temperature increase, skin contraction also increase. But most importantly, skeletal muscle from 1100 per ml per minute, it is like almost 10 times, more than 10 times, 11 times, 12,500 ml per minute. So you see, that's why exercise needs a lot of energy, and to supply oxygen and nutrition to the skeletal muscle, more and more blood diverted to your skeletal muscle. But there are certain organs like kidney, abdominal organs, and other organs slightly decreases during the exercise. And from 5,000, you are like 17,000. And most of the part goes to your skeletal muscle. Okay. So this is all in pre-lab learning of cardiovascular physiology, particularly the pulse and blood pressure. Thank you guys.